Morning, stop what you're doing and think about this for a second. African American women are 3 times more likely to die from pregnancy and childbirth than white women. That large disparity is something we don't often talk about, but it deserves our attention. And starting today, Virginia will observe its first Black Maternal Health Week. Jacqueline Quinn joins us with more. Good morning.
Good morning, Allison. Yeah, it's joining other states to ensure Black moms are being heard when it comes to health care, because when that's not the case, this also affects the life of the baby. Infants born to Black moms are twice as likely to die as those born to white moms. Now, we spoke with one Virginia lawmaker who experienced this problem firsthand and lost her firstborn.
I believe in my heart of hearts, had I gotten the proper medical advice, I would have had my son here with me.
Virginia Delegate Destiny LaVere Bowling and her husband were filled with hope after getting pregnant through IVF. But last year on the campaign trail, that hope turned to grief.
And to lose out on the joy of becoming a mother to a living child, I still consider myself a mom, but to become a mother to a living child, that was taken away from me.
Through pain, she delivered, then said goodbye to her son.
I was a little over 19 weeks, coming up into my 5th month, and I started having some cramping.
The pain intensified, and she experienced a discharge that gave her serious concern.
And I called the on-call doctor, and she told me, "Oh no, there's no such thing as a mucus plug. You're fine. You're probably just stretching. So lay down, drink water, and take some Tylenol."
Days later, she was rushed to the hospital,
and they told me, "Yeah, you were laboring all week. This is what you were going through, and it could have been prevented."
The tragic experience helped prompt her to push legislation to establish Black Maternal Health Week in Virginia, recognizing the urgent need to address this racial disparity.
In looking at how we can impact care, no woman should come into the birth setting or birthing person and not survive and go home.
Cheryl Bellamy is president of the Association of Women's Health Obstetrics and Neonatal Nurses. She says there's a critical need for diverse workforces, better healthcare access, and training to make sure everyone is treated the same.
Those include team training, such as simulation, respectful care conversations, unconscious bias trainings, and also involving the patient in the care practices that occur.
As work continues to address these disparities, it's clear the road forward remains a challenging one.
I was almost gone, in addition to our child also being gone at the time. So something's got to be done. The lives matter, and it's time that our healthcare system take more care.
And this Friday, Cheryl Bellamy and members with her association will be part of a U.S. Health and Human Services Black Maternal Health Summit to discuss how to improve outcomes. Anyone can attend, and it's online, runs 9 a.m. to 1 p.m. We'll have the link in our story on WUSA9.com. Allison.
Such an important topic, Jacqueline. Thank you for bringing it to light.